Okay, we're going to begin, and how we're going to do this next section is ask each of the groups to report out highlights of what was discussed during their group discussion, their small group work. And then we will have a little bit of time at the end for other comments from other group members. We are aiming to conclude this session a little after, by 1:15, and just to let folks know that lunch will be provided today, so there is time for us to get some lunch and to eat and to resume back at 2 o'clock. So there'll be no need to rush out into the cold. So we're going to do our breakout groups on translating knowledge into effective action, and the first group is Breakout Group 1, Evidence-Based Programming and Decision-Making Based on Community Needs. And that'll be Colleen.
Thank you. And certainly other participants in my group or leaders could join in. It was a very rich dialogue, but we discussed multiple dimensions of the case. What now? Alrighty. Better? Is that better? Is that better? I'll speak louder. How's that? So it was a great dialogue, very rich dialogue, but I probably would say we probably had more questions than we did answers, and talking about the multiple dimensions of the case. We started out by looking at the community, the realities and the challenges that were facing that community relative to... Sorry. Okay, can you hear me now? Great. So we talked about describing the community, trying to identify who the community is, what the needs of the community is, and then trying to think about practical responses given those conditions. Obviously, the information that everybody had in the case study broadly described the enormous challenges facing the community. We looked at what is the information that we thought was missing for us to think about how it is we would respond in a meaningful way with effective interventions. We didn't feel that there was sufficient enough data to understand some of the underlying realities and conditions that maybe prompted the evidence of violence. We didn't have a fuller understanding of what some of the assets of the community was. We knew what all the challenges were, but we didn't know anything about potential, though limited, infrastructures, whether it be around education, health programs, clinics, support networks, outreach workers, community-based efforts that might add to the array of assets that you could leverage for interventions relative to violence prevention. We didn't have a sense of any role of government or relationship with government or relationship with the surrounding community of Nairobi. So those were areas that we felt that we needed to have a little more understanding about. Then we spent some time talking about if you were going to look at the enormous challenges of this community that were located, and we focused on Kibera, whether it would be that you would look at the entire community or whether you would try to focus on a subset of that population. Would you focus on violence against women and girls? Would you focus efforts on perpetrators of violence? Would you look at young men potentially and using them as a way to mitigate violence by changing behavior on their side of the dimension of the equation of violence? We spent some time trying to think about, was there any evidence of any programs that had already worked to mitigate violence in that community area or in anything surrounding that might have some possibility of replication where we were focused at that time. One of the things we spent some time talking about was the need to do an adequate kind of search of evidence-based programs that might have the possibility for replication given the context that we were dealing with. We talked about programs that might have been successful in Jamaica or other parts of South Africa. Someone brought up a program called Image around income generation. So we started to think about how it is you would begin to sort through what programs might have some possibility. We decided that the focus would be, as I said, in that area of Kibera, and that it would be on youth. And looking at opportunities of evidence-based programs in potentially education, alternative education strategies, income generation, potentially job creation along with that income generation, but that there was a uniqueness to the community that had to be really addressed. Other kinds of things might be, somebody talked about an evidence-based program around male awareness and education to deal with issues related to gender violence. We also thought that we needed to have better understanding about the actual community from a mapping or even a surveillance perspective, trying to understand kind of where life occurs in that area. Where do youth hang out in that community? What are kind of the qualitative assessment questions that we need to better understand in terms of our activities? At the end, there was a general sense that to create a successful effort here, we'd need a real alliance of multiple partnerships, thinking about partnerships with the business community that surrounds in terms of potential funding or other opportunities there, partnerships with government, other NGOs, and that you'd need to create some kind of a coordinating network or body that could move a very kind of comprehensive initiative to reduce violence in Kibera forward. But I'll let my colleagues, that's my summation, but please feel free to add. Elizabeth, Daniel, others in the group?
You don't need a moderator.
I think you did an excellent job.
Same here.
I was wondering if perhaps people in that group could raise their hands so we could identify who was in work group 1 if they're in the room. Okay, great. Thanks, Elizabeth. Did you want to add something?
I just think it's an interesting long-term challenge, and even the timing for looking at the challenge was, you know, and following it through is going to be interesting.
Okay. Why don't we move on to, and I know that you may have to leave, Colleen, so we'll not give you all the assignments at the end for follow-up. Thank you very much to Group 1. Appreciate it. We have breakout group number 2, which is identifying and engaging key stakeholders. And Katrina is going to do the initial report out, and then we'll hear from others in the group.
Sure. I just want to acknowledge the assistance of my co-facilitator, Julia De Silva. And one of the themes that really struck me about this group was we divided up and focused on 5 different questions and had small groups first discuss those, and then we discussed all of that as a group. And it was just really remarkable how much uniformity there was across all of those mini groups, and so many different themes just sort of naturally dovetailed. So I think it was either a group that was harmonious that came together, or a harmonious sets of issues around stakeholders. So I think that there's probably about 5 to 10 minutes here that I can report out on. But if I had to summarize this with one word about stakeholders, it's trust. That was really the theme that just pervaded all of the questions. And one of the comments that was made at the very end of our conversation, I'm just going to start with this because I think it just really exemplifies the spirit of the conversation, which was, make stakeholders feel like they are your experts. You, being the stakeholders, you tell us, and that builds trust. So I think that was a really nice statement. I can't remember who exactly said that, but we had a great group. So that being said, the first question that we dived into is, who are the stakeholders? So there was a lot of discussion about that the recipients of whatever this program is going to be, that those are the recipients are your stakeholders. Similarly, whatever group is going to be implementing a program, that's another stakeholder. We talked, there was a whole sort of laundry list here about bystanders of a particular problem, the faith-based community, teachers, the infrastructure, what is the transportation system that will be getting people to the program, and also microfinance. We talked about understanding the business culture. In Nairobi, with the business community, is there social responsibility, to understand what that relationship is like, to understand, are they going to be partners in whatever this program is. We also talked a lot about defining the problem, so that coming in and thinking that a problem is one certain thing, you've really got to discuss that with your stakeholders and be sure that what you think is the problem is the same thing that they think is the problem. Otherwise, you've sort of lost it, from step one. Moving on, we then talked about, sort of who decides who those stakeholders are. We talked about the conveners will first do a first pass at guessing who those stakeholders are, convene those group of stakeholders, but then really be open to other ideas. So bring that first group together and say, hey, is this the right group? Are we missing people? And really be open to expanding that network and building alliances and being inclusive. We thought it was very important in terms of who convenes the stakeholders that you've got to partner with the community leader. This can't be something that's viewed as top-down. You've got to form an alliance with somebody in the community. And we also talked about that there might be, it's a different culture, obviously, so understand your culture. Is there a provincial leader? And one thing that I missed on the previous page is that another stakeholder group is really tapping into who has the most to lose. If once whatever this program is implemented, whose turf are you impinging on? And that you've got to bring that group in to bring them along the way and recognize that whatever that threat is may very well undermine your program. So engage them from the beginning. Which brings me to the next discussion that we had in terms of when you involve stakeholders. One remark was, well, it's simple. It's one word. It's at the beginning. But then we talked about this nuanced approach where you could really break this down into 4 phases. And we had someone in our group who was really able to speak to this. She has a lot of experience of founding and launching a community-based organization. And her advice was that, phase 1, you've got your convener as a stakeholder. Phase 2 is where you bring in the victims, the offenders, bystanders, and providers, the healthcare providers, and define the problem with them. Again, it was, the common theme was not to define the problem up here, but to define whatever the problem is with your stakeholders. Phase 3 is bringing in the researchers, the community-based organization, the faith-based community. And it was interesting, this phase we talked about bringing in the government, but not the people at the top. People who are more invested in programs. And the final phase for when you involve stakeholders would be post-implementation. Talk with the policymakers. What is the story that you want to tell about what your experience was? In terms of roles of the stakeholders, I think I've touched on a lot of these themes. One thing that I haven't talked about is that, so from the beginning, you build this coalition, you build this broad group of stakeholders, but at certain junctures, you're probably going to need to pull in an expert from the outside, that there's some sort of audience that you don't have on this group. And so just be flexible that, to tap into that expertise. And we also talked about a role of a stakeholder being to have them help identify other communities that have a similar problem and to being able to learn and leverage from that. A role of stakeholders is to advocate for public and private funding and to prioritize the needs of the community. In terms of challenges, we talked, so I've spent a lot of time talking about defining the problem, But that's also a challenge, is coming together and being able to be in agreement about what the problem is, coming up with a typology that's going to be, doing that really, really hard work up front about what the problem is will serve well later. A big challenge we talked about was jargon. Get rid of the evidence-based research jargon. Use language that is meaningful to the community. Translate it for them. And really being able to clearly communicate. And we want the community to understand what it is that we're trying to do and why we have to prioritize, because resources they're precious and they have to be reallocated. So there's a lot of great ideas, but why should we implement this one particular program? Moving fast here, we talked about the barriers. And the two big things that we talked here about were that the police are probably going to be a barrier to implementing some program. And again, we went back to this trust issue to be sure that you're really building that trust along the way. In terms of strategies for working with stakeholders, we talked about leveraging relationships. So putting the time in to develop and cultivate those relationships, but particularly thinking about corporations, the point was made that don't start from scratch. Find out what the relationship already is with a certain corporation, those businesses, the microfinance, and can you somehow leverage and build upon that so that you're not starting from the ground up. Working with a strategy for working with policymakers, folks really like the themes that we heard in the earlier conversations this morning. So talking with policymakers, what is their goal? How can we help you achieve your goal for the policymakers? And the last two things that our group discussed were working with the community to try to get some buy-in in terms of changing the perception of robbery. What are some ways to sort of turn that and change that perception? And finally is to really get involved in their success. So I know I've run through many, many pages of notes here. Can the folks in group 2 raise their hands? And then if anyone else wants to sort of add on something that I'm sure I've missed.
Does your co-facilitator have anything to add?
Building relationships, in terms of complementation with what you're saying about trust, is how important it is to build relationships in the community so you can be, more effective and more successful. And Ellen also raised the issue that, sometimes people do not want to do it, either because they don't think they need it or because they don't have the conditions. They just say, thank you very much. And you have to be flexible for all of the above. Thank you.
I'd actually like to ask if there are either Group 1 or Group 2, if there are folks who are in that group who would like to add anything that might have been not brought up in the front of the room today. Okay. Are we ready? Okay. Thank you so much. Let's go on to Breakout Group 3, which is adapting programs to local conditions and cultures. And we have Dina who's going to give the report out, and I think Mark as well.
Yeah, I think we'll do a co-report out. So our group was very diverse, and we actually had a cross-disciplinary, very, very rich discussion. And our starting point actually was first seeing not only where everyone was coming from, but someone very keenly in the audience asked, how many people have actually been to Nairobi or have done programs in Nairobi? And maybe not surprisingly, almost half or a third of the room raised their hand. And so that brought really a lot of context to what we were talking about. And though our session was on adapting evidence-based programs, we strayed from that, and partially because of the discussions from the panels this morning and also from our own understanding of this case, which is you can't really approach problems that were presented in this case study with a program, and that you really do need multiple approaches at multiple levels. And so I'm not going to repeat a lot of what the colleagues have said from sessions 1 and 2, but those conversations also came up in our session, and we agree with you on many of those points. Our starting point was also not to swoop in with approaches from other areas, but to do a very thorough situation analysis and look at your context. Look at the problem from the local context. Identify it from the local context. Look at what the risk factors are for that problem or set of problems, and really get to know the context. Know the social context, the cultural context, the religious context, the institutional context. What kind of infrastructure, what kind of systems are in place? What other structural issues are you dealing with in the country? Make sure it's highly participatory, this process. Make sure that you have the right stakeholders at the table, and that's not only the decision makers, although they're an important constituency. You also have the community and those affected by the problem. They're a wealth of knowledge, and they're very resilient and have much to offer and need to be part of that process. That's not to say that with prevention you often have theories or should have some type of scientific theory underpinning your approach. That's not to say that what we know is effective in some settings can't be brought along with some principles to a setting. But in terms of an actual intervention and methods, what we had been discussing was that may not be the most appropriate way, but really starting from the ground up. We talked a little bit about, with the situation analysis, the other thing that allows you to do, and I'm summarizing here, is that it really allows you to see where your entry points and your levers are, if you will, so that you really can come up with a more multi-pronged kind of strategy to address these problems. And you can look at the structural and legal barriers. You can look at the institutions and the institutional change that might be necessary, and you can see within communities and individuals what might be needed. And when looking at the communities and individuals and maybe segmenting out different parts of the population, you can have more targeted and tailored interventions, including in more targeted and tailored settings. And examples came up for the Kenyan context that might be important settings that may or may not be important settings elsewhere. For example, sporting clubs. Sporting clubs are really important settings through which behavior change programs can occur. And you also have places like hair salons, really important social organizing places for women in particular. So we talked on a more broad level on where to start and what needs to happen, rather than taking a program and adapting it to a local context. But I think I'll also pass the mic to Mark, who was the note taker and rapporteur and my co-facilitator, to add.
Thanks, Dina. That was a good job. I think it was really striking to us that we were given the charge of how do you adapt a program to a setting like Nairobi or specifically to Kibera for the prevention, say, of violence against women. And I think the answer that the group gave us is, you don't. And I think Michael Phillips said a couple of things that were very important and said them very clearly, and I should say without talking even about suicide, so that some of the principles that apply to suicide prevention also apply to other violence prevention areas generically. But one, he said, and Dina mentioned this, that you really need to start with a situation analysis. You need to define not only the problem that you're going to deal with, but who are the people involved in every way in the implementation, who are the perpetrators, who are the victims, how do you define the problem, what are the institutions that you have, and the police may not be willing participants, they may be the problem, so that you can't just assume that the infrastructure we have for our interventions here in the US are going to be anything like what you have there, but this full situational analysis to help you define the problem is really important. I think a second point was that the evidence-based programs that we have in this country are often based on theoretical models of how the problem evolves, what determines it, and how it might be solved. And Michael pointed out that all of those things may be very different in a very different place, that the social, economic, and political determinants, even biological determinants of a problem, may be very different there. So to think that you could take an intervention that's based on one theoretical model from this place and just import it there is wrong and misguided. And I think these were very, very important points. One other point that was mentioned that's very important is that there may be very different ways to intervene. So, for example, alcohol and an intervention based on the use or distribution of alcohol, which in Kibera may be mostly homemade and distributed and drunk in very different ways than we do here, may be an intervention point. And that may be very different from the way we think about alcohol as an intervention factor in this country. And I think the last thing we heard, and Chuchu helped us get clear about this, is that the social and cultural factors may be so different. And Ivan, you saying, helped us see that even in going to a place like one particular part of Chicago, the social and cultural factors may be totally different from what they were where the intervention was developed. So that the height of folly may in fact be trying to just adapt an intervention that you bring. And the fact that we call it evidence-based doesn't mean you have an automatic buy and that it will automatically fit in to such a different place.
Would the group members like to raise their hands?
And those on the webcast, you can wink at us from your computers. We're Charlie, the largest group. Thank you.
Or would the group members like
Like
to
to
add
Yeah, any other
anything.
comments?
Please, Phil.
The case history mentioned ethnicity, and I think we can't forget that. In many places, ethnicity overrides one's self-interest. You won't, if it's clearly in your self-interest, but if it's an ethnic conflict that's leading it, it can override it. And I think that's an element that has to absolutely be a central part of your situation analysis. Can you put people from different ethnic groups together? Can one ethnic group provide to another ethnic group case? You know, is that possible in that setting? It's essential. One other idea was you could find stakeholders who are clearly interested in this issue and then take them to other countries to look at what other people are doing and let them think what might be adaptable to their situation rather than us coming with something. Find out who really is invested in this particular issue and then show them around a couple of other low and middle income countries who are actually doing things that we think successful and have them think, well, maybe this is how we could adapt it. And the last thing, I think it's really important that we don't try and help people adapt to a horrible situation. We want to give them hope that they can change the situation. So whatever we're doing, it's not to increase their adaptive skills to deal with this hell that they're living in. It's to give them hope that they can change that hell. And it has happened there. For example, there they have schools that most kids go to that previously didn't. So in fact, there is positive change that you can reinforce and confirm their strengths. At the time, you still help them think, how can we move this situation better, rather than how can you adapt to where you are now?
Thank you. Any other comments? Yes, and please do go to the microphone so we can hear you.
Raul Huseman, University of Michigan. I want to build on some comments on both ethnicity and talking about groups. One of the things that I think creates difficulties in trying to intervene to prevent violence when Westerners go into other countries is the definition of violence. If a behavior is not considered violent within an ethnic group or culture, then it's going to be very difficult to approach it as preventing violence. I want to give two examples. Even in the United States, there are some subgroups, cultural subgroups, that don't consider spanking violent. And if you approach them to an intervention to eliminate spanking because it's violent, it's going to be a failure. In a number of countries, certain cultures, groups don't consider hitting your spouse really violent. I mean, I don't know what word they use. We consider it horrendous, but they don't see it. They see it as a norm. And in order to prevent that kind of violence, you're going to have to change the norm. That's really the first step. And some norms just are very difficult to change. I want to give one example, since we mentioned in our group, sporting groups. One of the best known examples of sporting groups related to violence, as many of you may know, is there was a youth soccer club in Morocco. Nobody was intervening with them. They just generally changed their norms to think that bombing trains in Spain would be appropriate, and they did. The group cohesion promoted them, their behavior, their common norms, and they thought it was okay. So I think we have to be very careful to look at norms and to think about differing norms in different cultures and subgroups.
Thank you.
One of the other issues or questions that we had to deal with was technical assistance and training. And I just wanted to reiterate the fact that it's not always that is the issue as much as it is capacity building. So if you go in with that thought instead of how you will not be coming back, I think you'll be more successful than not.
Thank you. Okay, and we will now hear from Breakout Group 4, Evaluation and Sustainability, and Tris is going to give us the update.
Okay, thank you. Well, it's ironic that our group goes last because as evaluators, we always complain that we're not brought in at the beginning. And our group struggled with not knowing what the other groups had already figured out. So we made some assumptions about the types of interventions that Group 1 may have come up with and the types of stakeholders that Group 2 were engaging and the types of adaptations or not that Group 3 were making. So I'll say that as a caveat before I start. And Anthony was my co-facilitator. He's got the detailed notes, so please jump in at any point. These are the real blueprints. They're the blueprints. It's the new blueprints. We had about a dozen people in our group. They were from all kinds of different backgrounds, research practice, community, international, domestic, so it was very rich. The first thing we talked about was data. And as Group 1 mentioned, you know, what kind of data is available and is it valid? Is it reliable over time? Is it being measured in a way that will answer the questions we have about the theory of change for the program that we were guessing about? And so we talked about, rather than bringing in a new data system to build on what the local capacity already was. Now, there were some problems with that. Some of our members brought up the fact that in this particular community, people don't want to identify where they're from and what their issues are for fear of retaliation, deportation, further violence. There were problems with official crime report data because the police are often the perpetrators of the violence in this area. So we recognized there were limitations with the existing data, but we still thought it important to work from there and improve from there. We also wanted to make sure that the data were relevant to the people in the community. So in addition to the official data, we wanted to talk to people. And I think that came up in all of the groups too. Getting the trust of the community to believe that we're not just there to study you, we're here to, from the very beginning, help create a sustainable belief, which was a concept Peter brought to us in our group, that things can be different, that there is hope, that you're not just adapting to a terrible situation. So we wanted to make sure that the community would be involved in the evaluation, would inform the evaluation, and would be able to continue almost business as usual. So it's not just a program that leaves and has to be sustained, but it's a new way of doing things. We also talked about causation. You know, we tried to guess the types of interventions that might be put in place, and it was a bit overwhelming for our group to look at the poverty, the structural inequality issues, the systematic corruption, the norms around violence that Raul just mentioned. So we weren't sure where the interventions would start, and we figured they'd probably address lots of them. And we thought about the comment Brian made earlier, the problem you define depends on your perspective, right, where you stand. So we would want to include the stakeholders as well in the evaluation design and process, the policy people, to the extent law enforcement would be, useful and would not make people scared to be involved, we would include them as well. And we were wondering about, the cost, right? So if we had a lot of money, we'd want to look at really deep questions about the structural inequality with poverty, with systematic corruption. But if we didn't have that money, we would just focus on those outcomes that were most important to violence against women, and then the longer term outcome of HIV prevalence. So we were going back and forth on that. As far as sustainability, we thought, well, you got to start at the beginning, right? So when in the process do you work on sustainability? It has to be at the very beginning. And as I mentioned before, we thought about sustainability in a couple of different ways. The traditional way is how do you sustain the intervention or the program, but we really believed it had to go farther than that. So sustaining a belief that things can be different. And again, Peter gave a good example of a program he worked with where these young men had been labeled as career criminals. Nothing could ever be different. But then this intervention came along, these young men did very well, and so there was a belief change among law enforcement, so they were more willing to sustain. So there was a sustainability about beliefs and values as much as it was the intervention itself, and I don't think we think of that enough, so that was important for us. And then the next piece was back to the community. You can't sustain it unless the community trusts you, they understand why, they see the benefit to them in their daily lives, not just a crime report, and they understand what it takes to continue doing it. And so again, going back to that theme of wanting to include the community at every point. Trying to think what else. What have I missed, Anthony? You sure? Would others like to, would everyone want to raise their hand and
Who's group
chime
4?
in?
Any in the room? Right, excellent. Any other comments or thoughts from group 4? Yes, and please go to the microphone, whichever one.
Eve Sullivan, again, Parents Forum and the International Federation for Parenting Education. I guess my question is both from and for our group as well as for the larger group. If we always talk about violence, we sometimes lose sight of what it is we're really looking for, which is more than the absence of violence. It's well-being, it's children thriving and having wonderful lives. So just to take the larger view, and how do we look for that? How do we look for well-being rather than just look for violence? So thank you.
Any others from group 4 groups? This is really a very vibrant discussion, and I went into a couple of the groups, and so I was really excited to hear and see the energy. And some of the things that I heard that I wanted to just kind of sum up with is we heard about that the great gaps in knowledge that have to be addressed, we have to look to the community for those resources and for that information. That was addressed in both evidence-based programming and adapting to local cultures and conditions. Groups talked about stakeholder engagement and ongoing, and as well as it changes over time and how stakeholders change over time. The challenges that I think I heard throughout these groups were things about economics, the economics of change and of status quo. What would it mean for me to have this change as a community member? What would it mean to stay with the status quo? And the roles and changing roles. What is in it for me to change? Will it benefit me, my family, or will this intervention be a challenge to my role? We also heard about looking beyond the data, that we need to identify with other interventions that are available, that are culturally relevant, that are perhaps economically similar to where we're working with. And I did write down what our colleagues stood up to say about technical assistance. I thought that was really critical that it needs to be bigger in terms of capacity building, again, culturally relevant and involving key stakeholders. And that the relationship with community is really central to evaluation. So I also wrote down a couple words, and I thought maybe as a way of ending this discussion, as I throw out some key words and ideas that I heard, if there are others that come up that you think of, I would certainly like to hear them from you. But I heard trust. I heard strength-based. We talked about community and stakeholder-driven. I heard multiple approaches, and I heard sustainability. Those were just some words and ideas that came forth in our discussion. And so if there's anyone who hadn't had a chance to comment, please do.
A word I would throw out is well-being. That just came up, a focus on well-being.
And I'd say hope. You know, try to give people hope that things will be better.
One thing actually we haven't really talked about much, and now I am going to put on my UN hat, is human rights. And earlier we talked a bit about cost effectiveness of programs and things like that, and we heard Chris's presentation on intimate partner violence in the United States, and how the question they were asking is whether support services and interventions for survivors were actually bringing down incidents. While it might not be bringing down incidents, that woman still has a human right to receive services. So I'm just throwing this out as part of our discussion because we haven't really talked about human rights. And when we're talking about evaluation and effectiveness, these are important considerations when you're trying to figure out where to invest and how, but it doesn't take away from some of the other things we still need to be doing and should be doing.
I think a lesson that struck me is that we need to think much more about portability. We have been designing interventions that are like the old desktop computers. And what we should probably be doing are developing mobile phones where the apps can be customized in the country. And I think if we start thinking about what we're building at the very beginning, when we start doing interventions in high-income countries, or start doing them in low-income countries because they teach us, but if we think about portability and translatability considerations from the beginning, we may end up with something that can be useful on a more widespread basis more quickly.
Yes, Kathy.
I think one thing that's been implied but hasn't been really named, we've talked about local people as stakeholders. Well, in Nairobi, there are a lot of very strong women leaders and men leaders. This has been going on for many, many years. And I think that having not just local stakeholders, but local leaders, I mean, they should be leading the activity. And at USAID, we've always tried to get a local counterpart to be doing implementation rather than coming in from the outside. So I think that looking to who are the local people who would be really leaders in this kind of activity.
Any others? Thank you so much for this discussion on our translating knowledge into effective action. It's been really wonderful. And now I'd like to ask you to join us for lunch. We're taking a break until 2 o'clock. Thank you.